Hey guys, welcome to the podcast.
Hey
Very
Tom. Hi
special
Patrina.
guest today. So I have my very own Sarah Snyder, who's an MSL recruiter on my team at the Carolyn Group, and Patrina Pellett, who is MSL or Medical Affairs Excellence Lead at MSL
Mhm.
Mastery. These guys are my partners in crime in MSL Mastery. We'll get to that in a second. Quick announcement, guys, do not forget to sign up for AI in Medical Affairs. It's a conference coming up January 28th and 29th. That's in Philadelphia. For more information, go to aimedicalaffairs.com. Go to my LinkedIn. There's a link in there. And if you type in the code MSL15, you get 15% off. And this episode's also sponsored by MSL Mastery. And I have my two partners in crime in MSL Mastery. So, Patrina, how great are things going right now? Didn't we just like 14 of our members just got MSL positions through our programs? Is that accurate?
Actually, Tom, I think it was 15.
Okay.
So
15.
it's been really incredible for those of you that aren't aware of the Aspire MSL program. This is a point and shoot program to help aspired MSLs land their first role. And it is incredible in terms of all the content. It has an online course as well as a ton of group coaching where Sarah and Tom come in hot and give unbelievable tips. You guys, the tips are so good that I'm texting other people outside that are not MSLs with these tips. I'm like, oh my gosh, you got to do this tip, LinkedIn tip from Sarah. Sarah, what would you add?
Well, I think that you hit everything, Patrina. I came on last night's call with my Santa hat, so I was really excited about that. I think that we have a lot of fun. And the number one reason I think that people quit or don't land their MSL dream job is that they get so frustrated and it's a lonely job search. So I think we've added that component and we come in and we just have a good time when we have live coaching calls. People have been so open and honest and hardworking. And when you surround yourself with those kind of people, you just can't lose.
Well, guys,
Yeah.
we're excited. I don't mean to take up
Mhm.
all this time on the podcast, but we're just really excited about all of the progress and
Mhm.
success that our members are having. And I can't thank Patrina and Sarah enough for all their hard work. So we are going to talk about today's topic is the top 5 frustrations for MSLs and how to overcome them. And this information, just so you guys know, is going to be based on a survey that was done that we did, and just feedback that we're
Yeah.
getting from MSLs that we're working with in coaching and um, people that have come on this podcast. So why don't we start with let's go through the top 5 frustrations and start with
Mhm.
what's number one. So Sarah, do you want to start with what is the number
Yeah.
one MSL frustration that you're seeing?
This one's so easy to say. It's definitely at the top of the list. It's access to KOLs. And when I say access, it's getting the appointment. But then when you do get the appointment, it's actually time with the KOL. So it's hard enough to even get a response to an email and get the time. But also when you get the time, then you show up, you travel from whatever state you're in, 3 states over, and then all of a sudden they only have 5 minutes for you. And I think that's the biggest frustration that you have done all of this learning in your PhD, PharmD, PA, NP program, and then you've done all your training as a new MSL and you get there and you don't even get to have a conversation, or you just feel like you can't develop the relationship if you can't get access to the person you're trying to meet with.
Katrina, what do you think?
Yeah, this is one of the top things that new MSLs reach out to me about. I
Mhm.
get messages almost every day exactly along the lines of what Sarah said. It's so frustrating to have this great scientific knowledge. And a lot of people think that when they become an MSL, that the KOLs will be lining up the door to talk to them. And they're really shocked when
Yeah.
this is not the case. So 100% having the same experience that you and Sarah are having, Tom.
Well, and I'll tell you, I just did a podcast on this on KOL Access,
Mhm.
and with Carson Snotwinkle and Gina Cooper, and it was awesome. And I have to give a shout out to Archie Stone because it was his idea. He brought that idea to me at Mass West. Archie's awesome, so
Yes.
shout out to him. But definitely check out that episode. And we're going to talk about how to overcome KOL access issues in a minute. But let's talk about what would you say like the number two frustration might be?
You want me to start with that one too, Tom?
Yeah,
I'll
go for
I'll
it.
give that one a crack because I actually just talked to a hiring manager today who is sharing with me some of the frustration that two of his MSLs have that their brand spanking new. They started 3 months ago. So they're entering the time where they've got to do what's called their certification at their
Mm,
company. So this is when you get done with your training. Some companies have you do a final checkout presentation. There's some type of an assessment. And he said they're struggling
Mm.
and it's information overload. And I asked him, what is what do they have to deliver? What are we talking about here? 262 slides, okay, are in the deck. I was like,
Oh
262
my
slides.
God.
What do you guys do? Take all the, he's like, well, it's a 2.5 hour conference call. And we sit there and they deliver the slides. And I thought, okay, you guys might, we can talk about what the issues are here, but it's information overload. This is so much information. That's the therapeutic side of it. And I know that we have one of our Aspire members that was saying too on the compliance end of it. All of a sudden you have all these compliance modules coming at you. So there's just information, information, information.
Katrina, anything
Yeah,
to add?
I totally agree. It is literally like drinking from a fire hose. It is so much. And it's also a really big shock for a lot of folks that transition into the role to realize that you really have to manage your own time, right? So, how do you do everything that's expected of you and absorb all this information?
Mm.
I don't know if that's like sneaking in
Mhm.
on one of the other five, but hopefully we have time to talk about time management too later.
You and your time management, you
Mhm.
are like
It's a thing.
obsessed.
It's
Yeah,
a
it is
thing.
a thing.
Mhm.
All right.
Mhm.
So number three. What's number three?
You already
Sarah,
started it, so
oh,
take that one.
oh, well, I think number three is actually role clarity, right?
Mhm.
Oh.
I think, Sarah, you as well get a ton of outreach with
Mhm.
questions like, am I doing a good job? Am I
Yes.
doing the right thing? And so
Mhm.
I think either I've been thinking deeply a lot about this recently, and I have an
Same.
article coming up on how leaders can communicate KPIs
Mhm.
and metrics to MSLs. But where is this gap? Like, why do
Mhm.
MSLs feel so uncertain about what they should be doing in the field and knowing if they're doing a good job? Sarah, what would you add on to this?
I like that one. I think you're hitting it because I think it's like, am I doing, when you said, am I doing enough? Like, how do I know if I'm doing it enough? I remember, guys, this is a funny story, but when I was first in MSL and I had the schedule where you are building your own time, etc. And I did a lot of dinner programs. And I thought, well, can I go to the gym like over my lunch hour? Is that allowed? Like, can I do this schedule or is that weird? Or should I be available all day long to take in case a physician calls me? Like, what is my schedule supposed to look like? What if I work a weekend or a medical conference when I come back? What should I be doing right away? Like all of that, that role clarity. I like that term.
Yeah, and it's lonely in the field. Like when you're
Hmm.
field based, you're
Yes.
detached, which makes it more difficult because when you're in an office, you can get up and talk to one of your coworkers and be
Yeah.
like, "Hey, is it cool if I do this?" Or,
Yeah.
what's the fastest way to get to the bathroom? Like when you're new and you're
Hmm.
in an office, you can ask people questions. But when you're out in the field, it's lonely in the field, and you just have to
Hmm.
kind of figure some things out on your own.
Yeah.
Um, what are we on? Number four?
Yep, I think so. All
All
right,
right.
Sarah, you go. Sarah, let's let Sarah go on this one.
Yeah, I think we can go with imposter syndrome here. All of a
Oh, yeah.
sudden, you're surrounding yourself with everybody is really, really smart, high performers. This is big, especially if you're a new team member on a team that's already established and you're a brand new MSL and you're coming in and it's going to be the imposter syndrome is going to be even bigger than it would be if you're a new MSL joining like a new team build. Then it's a little bit easier, Tom. And since you mentioned the loneliness factor, I think same with that. If you're joining a team where it's this new team build and everybody's starting together, there's more people that are going through training with you and you can rely on each other. Hey, what do you think about this? But if you're the one that's a backfill or is, a brand new role that is an add-on, that is where I think it gets even harder.
Mm, good one.
Mhm.
Yeah, we just published an article on the MSL Mastery blog on how to thrive as a new MSL, and we
Yeah.
called this imposter syndrome 2.0.
Hmm.
So what we
Hmm.
see a lot of helping all these aspiring MSLs, that there is a lot of imposter syndrome already going on, right? We get a lot of questions. Can I do this? Am I qualified? But then when they actually land the role, it skyrockets even more for all of the reasons that Sarah outlined as well. And so this is, I think, a really big challenge for a lot of new MSLs.
And I also did a podcast on imposter syndrome
Of
because it is
course.
such,
Hmm.
well,
Hmm.
it's such a
Yeah.
big
It's just
thing.
such
And
a
I
big
hear
thing.
about it
Hmm.
all the time. It's just,
Hmm.
it really is so common. It's a solo episode. It's from a while ago, so you got to kind of dig to find it. But I get a lot of comments on it. A lot of people are like, "Oh my God, that was so great." Anyway, so let's go to number five. And I guess this might be the last one. We said top five, but we might have a bonus one too. But what's the
Hmm.
fifth one?
Sarah, what is the fifth one? I don't
It's
remember.
communication
Okay.
challenge. It's
Yeah.
you know all your information. You have now gone through your certification, or if you don't have that, you're just ready to go. And you know the data, but you don't necessarily completely have how to translate the so what to the KOL yet.
Yeah, and we've even received
Hmm.
some feedback from new MSLs that they told us something like, my manager is telling me that I'm data dumping.
Yep.
Right. So this is
Hmm.
exactly a communication presentation issue. And a
Hmm.
lot of times it's a big shock for especially PhDs like me, where you're used to
Yep.
giving a certain type of presentation and that's what is expected. Now you've got to basically unlearn that and flip it on its head and really change your communication and presentation style.
Hmm.
Mm.
Tom, I told Patrina this story the other day, but when I was in new MSL, I got my very first question about using a product off label. And I can remember this. I was so excited. I go home, I do my literature search, I check our internal databases, found a lot of information for this particular physician. I remember going back to him and I had like 12 different abstracts. And I was like, I won't say the doctor's name, but it was in Indianapolis. He was really, really kind. And I'm like, here's all the stuff I found. Da, da, da. And he was like, I'm going to give you a little advice.
You know, that's a bad sign, right?
Yeah. He's like, I know that you're relatively new, we're building this relationship, but he told me, hey, you need to come back with a little bit more tailored information. And I was like, oh, okay. Like, it's not more isn't better here. They're looking for the answer that matters to them, not necessarily all the information. And then I mean, obviously they've got to make the decision and they have to analyze the data themselves, but really you got to be able to deliver the so what.
Mm. Awesome. All right. And so that's the top five. Patrina, you said something about a bonus one. Did you want to throw your time management thing in there?
Oh, okay. Time management. As I already said,
Mhm.
it's a shock, especially what we're seeing with clinicians, practicing clinicians that transition over, right? You have pretty structured days where you're seeing a lot of patients back to back, and then all of a sudden you are in charge of your own schedule. So if you combine
Mhm.
that with some imposter syndrome, some lack of role clarity,
Mhm.
then you really don't know what you're doing, or you really feel like you don't know what you're doing and how to manage your time. The little
Mhm.
story, a new MSL recently told me that he's loving the 2:30 p.m. naps. He thought this was a
Oh.
huge bonus because he was working in the pharmacy
Mhm.
all day and he was
Mhm.
like, these 2:30 p.m. naps are legit.
Wow.
What?
Okay.
What are you
So,
preschool?
Kindergarten. Yeah.
oh, it sounds great to
Mhm.
me.
Mhm.
You well,
Like,
that you're a hippie. That's why. It's perfect
oh,
for
come
you.
on. You think all
Oh.
hippies like naps?
Yeah.
Mhm.
Me and Sarah work in triple sessions. There's no naps
Yeah,
for
no
Oh,
naps.
overachievers.
please.
We don't nap.
Oh, please. The overachievers rest the hardest, right? They're like the best at
True.
napping.
Well, I'll tell you one
True.
thing.
True.
Like I work my freaking ass off, and when it comes time to like go to sleep, like
You
Mm.
go to
it's
sleep,
oh yeah, I'm out.
Mhm.
Just
Mhm.
yeah.
Mhm.
It's like I
dead
got
to the
shot in the
world.
head.
Yeah.
Um sorry for that visual. But all right, let's recap and go
Mhm.
back over the list. But let's talk about how do we overcome these challenges. So, Sarah, what is your advice for people that are struggling with KOL access? How do they overcome that?
Persistence is the easy answer here, but it doesn't mean doing the same thing. So if you try email and you're not getting a response, don't just send the same type of email again. You either need to recraft your subject line, recraft the entire email, get some type of warm introduction from somebody internally, try a different individual in the office. Don't just send the same email and say, following up again, haven't heard from you yet. That's persistence, but it's just doing the same thing over and over to expect a different result.
Hmm.
So I would say get creative. I know that we've got some different ways that we recommend access to difficult to reach accounts. And pretty much now everywhere is difficult. Patrina, do you want to chime in on that?
Yep. I 100% agree with everything that Sarah said. And I would add to this, I got to look at my notes. I was like,
Mhm.
what was I thinking?
Mhm.
Definitely create a mindset around adding value, right? This
Mhm.
is what you should be thinking about doing first. If you're not getting responses, you're not hitting them with their top challenges. Like that's the bottom line there. I did a hack recently with a hospitalist and he gave 4 insider secrets to KOL access. And he gave this really great example where he said that he actually responded to a cold email from a sales rep because it addressed a core challenge and problem
Mhm.
him and his team were having at that time. So that it was he paid attention and had the meeting because it
Mhm.
was really addressing his challenge. So think about what are your KOLs and HCPs facing? What are their problems and how can you help? And to Sarah's point, don't do anything like, oh, just following up. That's not
Mhm.
adding any value. They don't want to respond to that. They're really, really busy. Can I give one more?
Yeah,
Or,
go for it.
okay.
Mhm.
I did another hack that I did recently was in collaboration with this very experienced med device sales rep. And he said something that I can't get out of my mind. He said, for these top KOLs, an email is not going to cut it. Like you will not be able to get in. They're just too busy, too important. And we have 8 different ways that you can level up your warm intros. So I know Sarah already mentioned this one, but I just really want to reiterate, especially if you're new, you don't have the relationships, you don't know the HCPs,
Yeah.
you need to have a system for mining your network, your company's network to get those introductions because that's
Mhm.
what's going to give you the breakthrough. Um,
Love it.
as another really small plug, Sarah and I have this amazing KOL access program where we take you through all of these different steps to really help you get in front of those hard to reach KOLs and HCPs.
Good.
Mhm.
That's really good info, guys. I was
Mhm.
gonna add that last piece that you said, Patrina,
Oh, I
about
stole it. Yeah.
you stole it. Yeah.
Yeah.
Well, I listen, I just had that podcast with Karsten and Gina and they talked about a lot of this stuff that you just talked about, but the relationship piece, leveraging internal relationships and your network to be able to get information that's going to help you get access and get in front of people. And, information is definitely power. Relationships are going to be really helpful.
Mhm.
Leverage those internal relationships with your sales reps and counterparts. Okay, number two, how do we
Mhm.
overcome? Let's see, number two was role clarity.
Info
Info
overload
overload.
is what
Oh,
I have.
info overload. Yeah. So,
I'll
Sarah, you want to
start with
start?
that one. Yeah, I'll start with that one because I was talking about the certification
Hmm.
and you get all of a sudden all these articles, you get these slide decks, you just automatically jump in and start reading and start going slide by slide, slide by slide. Maybe you're writing everything down. One of the things that you can do, this transformed the way that I learned, is something I learned from Jim Quick. He teaches how to learn to Google, to all the major big corporations. His book is called Limitless. He says to ask yourself 3 questions before you dive in. So you ask yourself, how will I use this? When will I use this? And why will I use this? So before you read the article, you sit there and think, which type of physician would I use this with? when might I talk about this particular thing? Would it be like a mid-level? Would it be somebody that's concerned with safety? Like who, when am I going to use this and then why? What would be a reason that I would want to pull up this information? That starts to get you thinking about the so what while you're reading the article or tabbing through the slide deck. I think that will just level you up. The other tip is always going to be find yourself a partner so that you can talk through the data. Don't just go back and forth with what you think about it. Talk about what you think the outside clinicians will think about it. So PhDs, PharmDs, MDs, MPs, we all start to talk about, oh, well, I think that we should have done this analysis. That's not really going to get you very far, and it's just going to take a lot of time. So start to think already, how is this going to be received? What could be the possible questions that we would get about this?
Cool.
I have a great add-on to this and
Mm-hmm.
so many hacks for you guys as well. Start leveraging these AI tools. It is
Yeah.
absolutely mind-blowing what they can
Mm-hmm.
do with paper summarization and review.
Yeah.
There's one tool in particular, ping me if you want to know more about it, where it has a feature called Chat with PDF. And so
Mm-hmm.
similar to what Sarah was talking about with an accountability partner to help with your
Mm-hmm.
learning, a lot of these AI tools will do it for you. And so this will help enhance your learning so that you can have those better conversations and really focus on the so what.
Mm-hmm.
Also, I just had a podcast that is going really crazy. The MSLs are loving it, but
Mm-hmm.
the Google tool Notebook LM, you can upload a scientific paper, click a
Mm-hmm.
button, and have it generate a podcast. And it's pretty good. So then you can start, I don't like the word multitasking, but while you're going for a walk or maybe doing the
Yes.
dishes, you can also listen to get the high level overview
Mm-hmm.
of this paper. And then I think layering that on top of what Sarah said with those three questions,
Mm-hmm.
that's amazing. So definitely leverage technology to help
Mm-hmm.
you stay on top of the literature. This is a huge challenge for a lot of MSLs.
I think that podcast idea is going to put me out of business.
Yeah. Mm-hmm.
I'm going to have to
Or
look for
maybe
another job.
It is really yeah.
no, or maybe you'll have people will be making podcasts out of your
Out of
podcast.
your
Maybe.
Yeah.
podcast. Uh-huh.
Could be.
Like
Yeah.
tips from Tom.
Yeah.
All
That would
right.
be great.
So number three, number three is role clarity, correct?
Mhm.
Yeah.
So how would you advise MSLs handle learning more about the role and overcoming role clarity issues?
Sarah, what do you think? You want me to go?
Yeah, you take this first.
I'm thinking of this from the perspective of the MSL,
Mhm.
and I think one of the best tips for this is to feel comfortable or overcome your fear of asking questions to your manager and
Mhm.
your team. At the end of the day, you need somebody helping you. You're brand new, you don't know what you're doing. Someone has to show you, and that starts with asking for help and
Hmm.
being brave enough to ask your team for help.
Hmm.
So I think Sarah and I and Tom have a lot of people reaching out to us because they're too scared to talk to their
Mhm.
team or their manager. So just you might be surprised how much people want to help you. I really encourage you to just get clarification and be brave.
Hmm. Hmm.
Sarah,
Sarah,
what do you
anything to
think?
add?
Yeah, and when you get the advice from experienced MSLs, take it.
Oh, yeah.
I'll be honest, that's one thing that I struggled with when I started. It's one of those things where you're at a medical meeting, you come back and you think, well, I have meetings on Monday too. That's not going to get you any award. It's only going to lead you to probably getting sick and getting burnt out. And so you've got to maintain some time and some continuity in your life for things like exercise, things like getting back on track with your family, or again, you're just going to be a very unhappy MSL after a year. And even if you win that MSL of the year award or whatever, it's not going to mean too much because you're going to not have the energy that you should for the next year.
Yeah. And in any walk of life, there's
Mhm.
always somebody that's gone before you that's done it
Yes.
and done it better. And you look at some of the best athletes out there,
Mhm.
they always had mentors. They always had role models.
Mhm.
They came into the league and I know for myself when I first started in sales, I just migrated to the people that I thought were the best at it and
Mhm.
just asked a million questions and shadowed them. And I
Mhm.
just wanted to learn from the best. And that's just, it's human nature, but like Patrina said, you have to ask.
Yeah.
You have to put yourself out there. Okay, so we are on imposter syndrome, right?
And you just answered that, Tom. I think that the whole goal, right, of improving yourself is to surround yourself with people that are a level up from you. So if
Hmm.
you're doing that, imposter syndrome is a natural thing. You
Hmm.
should feel like that. But I think the tip that you just gave is number one of what I would recommend to do. It's just ask, like you guys both said, ask them questions, learn from them. Use imposter syndrome as a positive thing. It's not something that has to bring down your confidence level. You're there. You're in the room with these people and you earned your right to be there. And now it's your chance to continue to learn and continue to grow.
Yeah, and I'll tell you, there a lot of people might respond to that and say
Mhm.
something like, "Well, fake it till you make it," right? You hear that, fake
Mm.
it till you make it. No, just
Mhm.
make it. Don't fake anything.
You made
Be
it.
it.
Hmm.
Just
Yeah.
do it.
Hmm. Hmm.
You take that step. You learn from your peers. You do the
Hmm.
extra work and you do the thing, whatever that thing is. So if it's MSLing, you do
Hmm.
your best at what you know about MSLing. And then the next day it's going to be easier. And the next day it's going to be easier. You're going to learn more and more and get better and better at it. Nobody's perfect the first day
Right.
or the first year.
Hmm.
But the way you get there is one step at a time. I'm sorry, Patrina, I
Love
just
it.
like steamrolled you.
Yeah, like wasn't it
The
my
heck?
turn? Yeah. No, that was really great. I was like, what am I going to say? So that was perfect. It
Hmm.
gave me time to think. Something that helps me, and definitely reach out to me if you agree or disagree.
Hmm.
I think about it from the perspective of the other person and what their expectations are. And they want to work with somebody that's really confident. And I think about that a lot because I've been in the receiving end of that. I have a small story. I think, Sarah, I told you this story. I had, or maybe it was you, Tom, but when you have to go to the dentist and you have to get the big X-ray, like
Mhm.
the smile
Mm.
one. So there was a tech there, and she was like so timid and like lightly trying to put on the vest, and like she just seemed so unconfident. And I was like, are you qualified to operate this thing? Like, should you be actually doing this? Like, should I be scared?
Hmm.
And I think about that a lot because that's not how I want my customers to feel, right?
Yeah.
Like, when
Yeah.
I talk to a person and they're confident and they seem like they know what they're doing, even if they maybe don't, it makes me
Hmm.
feel confident. And so I think about that a lot when I'm interacting with somebody and maybe I don't feel as confident as I would like, or I'm having
Hmm.
some imposter syndrome. One other kind of mindset shift that I like to do, I always remember that they don't want me to suck either. Like
Mm.
people don't want to
Hmm.
interact with people that are
Hmm.
unconfident, and
Hmm.
uncertain. And so that motivates me. I'm like, oh, they're cheering me on. They want me to do a good job. So I think that really works for me. Let me know what you guys think if that's
Hmm. I
No,
like
stupid.
it. That's
no,
good.
that is true. The
Hmm.
confidence piece, like
Yeah.
getting to the point where you feel really confident in
Hmm.
your own skin as an MSL is really, really important. That's a really good analogy because I think
Hmm.
that that person was probably new
Yeah.
and she probably didn't want to mess up your teeth or whatever. I don't know,
Yeah, she was
but
like going
at
to shoot
this,
me with X-rays or something. I
yeah,
don't know.
yeah.
Like,
Hmm.
But I talk about in the imposter syndrome podcast episode, I talk
Hmm.
about how important it is to give yourself some grace.
Hmm.
yeah.
You can't be your own worst enemy, and that's what happens with imposter syndrome is doubt, and you have to give yourself a little bit of grace to overcome that doubt and realize that you're human and you're going to learn, you're going to get there, and you just have to take it one step at a time. So what are we up to? I'm losing track.
We're on number 5.
I'm a terrible host. I should be writing this stuff down. I know we're
Yeah.
on number 5. What is
But-
it,
Oh,
Patrina?
communication. Oh, Sarah,
Okay.
did you not know either? I just looked at your face. It's
I was
communication.
thinking we were talking about the time management one. So we're doing communication. You take this one, Patrina, and then
Yeah.
I'll chime in.
This is something I get outreach about a lot.
Hmm.
We see this all the time. How do I present this data? How do I
Hmm.
not data dump? How do I connect with my audience? Even down to what do I say to these
Mhm.
KOLs. I have to do an ad board. What do I say to them? I would say that practice, practice, practice. This is really important. And the more you do it, the easier it gets. The first time is going to feel horrible. The second
Mhm.
time will feel less horrible. You'll get
Mhm.
better and better at it. And also to experiment, right? Figure out if you're trying to present to a different type of stakeholder or HCP, really put yourself in their shoes. Try something a little bit differently and see how they respond. That's going to help. Definitely, I know Tom and Sarah will echo this. Get coaching. It can be so helpful. There are little
Mhm.
things that you're not recognizing. And now I'm just
Mhm.
rambling, so I'm going to let Tom and Sarah go.
You're
Yeah.
data dumping, Patrina,
I
on the
know.
Yeah.
communications part.
It's the
Oh
PhD. I
no.
can't stop it.
Jeez. Here's
Yeah.
what not to do, folks.
Yeah. That
Okay.
was an example of what not to do.
I'm gonna go with the most important thing. I mean, that's so simple, and I think it's one thing that always brings me back, especially if I have slides. So if I had, as an MSL, if I had a slide deck to present, think about for every single slide, what's the most important thing on this slide? Or what is it? And if there's not a most important thing, then it might be one that you can just go through really quickly. So if you think about that, it'll make you, what do I want to say? It'll just make you really zero in on the things that are most important to the person that you're talking to and less apt to data dump. It's hard, like Patrina said, it's going to take a lot of practice, and you also have to get to know your audience so that you know how to better tailor that most important thing. But most important thing are three pretty keywords to remember.
Yeah.
Tom, can I
And-
tell the story about
Yeah.
Sarah really fast? So,
Mhm.
Yeah.
Sarah and I teach a lot of frameworks around
Mhm.
presenting to help people learn this and get better at it and to avoid
Mhm.
data dumping. And we were on one of our Aspire MSL calls, and one of the aspiring
Yeah.
MSLs called out Sarah. She was like, what about the most important thing? I think you
Oh,
listed more than one. I thought it was so funny and so
that is
cute.
funny.
But yeah.
Yes. Well, sometimes we'll have someone that's doing their practice presentation and they'll go over the entire slide or like three slides, and then you'll ask them, what do you think was the most important thing? And then they'll have this two sentences that sounds so eloquent. And I
Perfect.
was like,
Yeah.
okay, that was it. That was it. That's all you had to say. It's less
Yep.
is more.
I love it.
Hmm.
Ironically, we are getting very long on time, and
Hmm.
time management is the next
Hmm.
topic. So go
Yeah,
figure.
I'll
We're
write
not
that
doing a
out.
very good job managing the time here. So let's quickly just finish up this conversation with what, Patrina, you're the queen of time management.
It's
What
true.
would you say, folks that are struggling with time
Mhm.
management frustrations, what advice do you have?
First thing is to listen to the podcast that Tom and I did on a time audit. That was a month or so ago,
Yeah, a
Tom.
couple
You'll,
months ago.
yep,
Yeah.
check that out. Go to the MSL Mastery website, download the time audit worksheet that we
Mhm.
have. It is a really great starting point. And then start experimenting with systems. There is no
Mhm.
single time management system that works for everybody, even for the same person, because you change over time as well. So
Mhm.
figure out where you spend your time and then experiment to get a system that works for you. And then, of course, follow me or ask me. I have a ton of resources on time management. Once you nail this, I'm telling you, it's life changing. Like you feel great.
Sarah,
Mhm.
final words.
The last one from me is just to make sure to schedule some time for yourself, especially after a lot of travel. So, time management doesn't mean that every single second has to be devoted to work. And when you're doing this travel, you've got a brand new role and you do have imposter syndrome. You've got to make sure that you schedule some time to have some decompression and get back to whether it's reading a book, going for a walk at home. You got to get that on your calendar too.
Important stuff. Personal
Hmm.
growth, development. Love it. Guys, this was awesome,
Hmm.
and I am really excited to hear from you all because I know that this is going to be a popular episode. If you liked it, please share it with others,
Hmm.
and interact with us. Comment. We love your posts. We love hearing from you. Sarah, Patrina, happy holidays to you both.
You
Thank
too.
you for being
Hmm.
here. A lot of fun.
Thanks, Tom.
Yeah,
This was
thank
fun.
you.
Hmm.
This is great.
All right,
Yes.
guys, we'll see you next time. Love you all. Appreciate you
Hmm.
all. And yeah, have a happy holiday season.
Happy holidays. Bye,
Happy
everybody.
holidays. Bye.